kind of an overview here with the 3D anatomy. So we're starting off with the renal system, and we're making our way all the way to the posterior aspect of the abdominal cavity. So as you can see, we went all the way through the abdominal structures. In order to get to where the kidneys are, we got to go right to the back, really close to the posterior body wall. Here we can see the liver on the right side, which is slightly obscuring parts of the right kidney, pushing it just a little bit lower than we see the left kidney. We can also see the ureters to some extent that are communicating down to the bladder. And in the center, we can see the vertebral column. Now, as we continue to peel those layers away, we can see the adrenals on either side on top of the kidneys. We can see the hilum of the kidneys where the ureter, the vessels are located, that indentation of the medial aspect. As we kind of look inside the kidneys, we can see the pyramids. So if you remember me talking about the pyramids as these triangular shaped structures inside the kidneys, we can begin to see the pyramids, which are closer to the central aspect of the kidney. And that is to be distinguished from the cortex, which is closer to the outer surface of the kidney. So renal pyramids here, the outer surface being the renal cortex, and then the adrenal gland on top. So as we strip that away, we can begin to see the calyces. So we start off with the minor calyces, which are leading right from the renal papilla, coming from the renal pyramid. That communicates to the larger major calyces, which eventually communicates to the renal pelvis, and finally to the ureter on either side. Then we can see the ureters, which are leading down to the bladder. The ureters kind of take a bend here as we enter the pelvic cavity. They have to go over the ridge of the ilium on both sides, and then they enter the pelvic cavity. And they kind of take a dip towards the bottom, where, as we'll see, they communicate to the bladder. So here's the bladder. Here we can see the urethra, which is exiting the bladder. And let's kind of go to the back so we can see exactly where the ureters, well, we're not actually seeing that, but the ureters kind of go, as we mentioned, down towards the bottom and communicate at the area that is bordering the trigone. Okay. And we can see where the bladder is in terms of the pelvis. So here is the pelvic cavity, here's the bladder. We're not seeing any genital structures, but the genital structures will look a little bit different depending on male and female anatomy. So in females, the bladder is going to be sitting in front of the uterus, so the uterus would be here. Whereas in males, the bladder is sitting immediately in front of the rectum, right? So there's no uterus in males. Okay. Let's look at the female reproductive structures here, kind of an overview again. We're going right through the initial abdominal fat, all of that, and we strip right down to where we can start to see some of the female reproductive structures. We can start to see the urinary structures as well. The ureters here, the bladder here, the urethra here. And then as we strip all of that away, we can really see the female reproductive structures kind of embedded with those urinary structures. So as I mentioned here, the bladder, the uterus is going to be in between the bladder or behind the bladder and in front of the rectum. We can see parts of the fallopian tubes here, the ovaries here. We can see the urethra, as I mentioned earlier, the bladder, the rectum posteriorly, and then the vagina here in between both of those structures. So urethra, vagina, rectum. And we can see that much better from this, sagittal view. Now, as we strip away some of those urinary and GI structures, we can get a better sense of the reproductive structures alone. So the ovaries on either side, the fallopian tubes, the fimbriae of the ovaries, of the fallopian tubes rather, and then the uterus here, the vagina here. Now we can see some of the ligaments that I mentioned before. I don't think we mentioned the suspensory ligaments, but they are also helping to suspend the ovaries. But then we have the round ligament, which we did mention, which communicate to the labia majora, as well as the broad ligament. So hopefully we can see the broad ligament. So the broad ligament is more of a sheath-like or curtain-like ligament that wraps over the fallopian tubes. Okay, looking more at the genital structures, we can see the clitoris. And remember, although we're only seeing the glands of the clitoris in terms of a gross inspection, we want to appreciate that the clitoris is kind of hidden. There's the crus of the clitoris, and then there's the bulb of the clitoris, which we can see here, but is really hidden beneath the skin. We can also see the vaginal orifice as well as the urethral orifice. So the urethral orifice is going to be within or just beneath rather the glands of the clitoris or the clitoral glands. So here we can see the other structure. So the mons pubis would be on top here. The labium major, so the labia majora, which is also called, and then the labia minora, and then the vaginal orifice, sometimes called the vestibule. Okay, so while it's not shown here, I want you to have an appreciation that the bladder should be right here. So right in front of the uterus or the fundus of the uterus, we should see the bladder here and the rectum posteriorly here. Okay, so that is it for the female structures. Let's take a look at the male structures. So we start off right away, we can see the testicles or the testes, which are hanging outside of the abdominal cavity here where they're paired, although this looks very conjoined. So they're paired on either side. And we have the scrotal sac actually where the testes reside. We can see the penis as well here. And then as we go a little bit deeper, we can see the spermatic cord. So this is the spermatic cord on either side, which has in it the testicular artery, the pampniform plexus, which becomes a testicular vein, and the vas deferens. I want to point out here as well where the spermatic cord ends. So the spermatic cord is communicating through the inguinal region on either side, and then eventually the vas deferens leaves that structure and goes over the bladder. Hopefully we can get a better view of that, over the bladder, and communicates via the ampulla to the ejaculatory duct. Now, what's being shown here are some of the muscles of the pelvic floor, which we did not look at, so we can kind of skip right over this. And then we can also see some other structures which we should be familiar with: the sacrum, the coccyx, the external anal sphincter, which we talked about in the GI, the coccygeus muscle, which is part of the pelvic diaphragm of the pelvic floor, and some of the other muscles thereabout. So let's get a better view here of the male structures as we strip away some of those other surrounding pelvic structures. So we can see the seminal vesicles. We can see the vas deferens, again, coming from the spermatic cord. The vas deferens will leave the spermatic cord, continue over the top of the bladder and communicate via the ampulla. So here's the ampulla towards the ejaculatory duct, which is going through the prostate. And then the seminal vesicles also communicating into the ejaculatory duct as well. We also see some of the other layers of the fascial and connective tissue layers of the scrotum that are also kind of separating scrotum from testes that are outside of the scrotal cavity. We can see the cremaster muscle. So the cremaster muscle that I mentioned, which helps to elevate or descend the testes. We can see the ductus deferens. So the ductus deferens is also called the vas deferens. Just to be clear, we can see the ureters on either side communicating to the bladder. We can see the bladder. We can see the external urethral sphincter here, which is not to be confused with the internal urethral sphincter found closer to the bottom or the base of the bladder. So here's a very nice kind of side profile of all of these structures. And again, I want to point out where they sit in the pelvic cavity. So this is within both halves of the ileum. And we can see the coccyx and sacrum here. We should also remember that the rectum should be right here posterior to the bladder, although it's not shown. Okay, let's look at some of the structures of the penis. So we've got the corpora cavernosa, which are the paired erectile tissues. And then we have the corpora spongiosum, which is the singular erectile tissue that's found where the urethra is found, rather. Getting a little bit closer to the ejaculatory duct, we can see both of the ejaculatory ducts, which communicate into the urethra, specifically the prostatic part of the urethra. If you remember the urethra having three separate divisions: prostatic part, the membranous part, and then the spongious part of the urethra as well. Yep. So those three parts of the urethra: the prostatic, membranous, and then the spongiform urethra. Okay, I'm having a bit of a brain fart, I apologize. Here we can see the end of the penis, or the glands of the penis. And then as we get a little bit deeper here, we can see the testes, we can see the epididymis of the testes with a little bit more clarity there. We can see the tunica apogynia of the penis. We can see the tunica apogynia of the testes. We can see the bulbourethral gland. So another one of those glands that contribute to the secretions that form semen, located at the base of the prostate. And then the spongy urethra, the intermediate urethra, which is sometimes called the membranous urethra. Both of those terms are interchangeable. And then the prostatic urethra, specifically the part that runs through the prostate. Okay. As we get deeper here, we can see the rete testes, as well as the epididymis of both of those testes, right and left. Epididymis, epididymis. Okay. So that is it for the male reproductive structures. I hope you get a better sense of kind of the overall neighborhood anatomy of both the reproductive male and female structures, as well as some of the urinary structures.